long, which is great. So I think we'll just start in with folks who are going to be sharing some really good information with us. So Todd, you're up next on the agenda.
Okay.
Hop on up here.
Do you want me to come up there, or?
What would you like to do?
Oh, it doesn't matter. I need to navigate the slides up there, right?
I can run them for you if you'd like.
That's right. I'm going to send around. Yeah. Sorry, this.
No, that's
Just so you can see him.
Yeah. So what I'm sending around right now, and apologies to folks that joined remotely, copy of the slide presentation, copy of the Denver SNAP Task Force report, and then a little bit of additional propaganda there, if you will, from Denver Human Services, our new strategic plan, which I'll explain a little bit more in a minute. But thank you for the opportunity to present this information to you today on the Denver SNAP Access Task Force. Dr. Stenmark and I had the privilege to co-chair this group together, which wrapped up its, did everybody get one? I probably should have explained it. It's a packet, actually. So I don't know if everybody, there's like 3 documents in there, but I've got extras I can give folks afterwards if you want.
And we'll share this electronically for those of you who are joining us remotely with the previous one.
So just really quickly on the task force, and then I want to just back up and give a little more background before I get into some of the details on the task force. But and Sandy, I know you have your own presentation to do here in a minute, but feel free to jump in. You know much about this as I do. So the task force was took place over about a year's time. It was a cross coalition of about 40 different community partners. Everyone from the more traditional ones like the County Human Services, Hunger Free was a major player in that, to some more welcome, I would call maybe non-traditional or newer, at least for me, participants like retail, people with lived experience, and others. And so we were picked. We were one of 3. Oh, and I should mention also that Jack and Anya were big part of this work as well. So thanks, guys. So we were picked as one of 3 cities across the country to do this work. We were Target, the retailer Target, decided to invest in this area, and with the help of a couple of national conveners, the Food Research Action Committee Center. Yeah. FRAC is, but I don't like to use acronyms unless I can spell them out. Clearly I can't. So FRAC and the Food Trust were the national conveners, and then here locally Hunger Free helped us facilitate that. And so, so 3 communities, I think through Oakland, Houston maybe, and Denver were picked based on sort of, I think, different elements, maybe room to improve, as well as local political context being open to wanting to make some changes around this work. So we were thrilled to be able to be a part of that. But first, backing up, I just wanted to say, this is great timing. We talked a little bit earlier about the timing sort of a governor that really supports understanding food access and hunger issues. And we have the same locally in Denver. We have a mayor that's very supportive. I have an executive director that's very supportive, and we have a great community to work with. So, so great timing there to really kind of try to dig into this work. And that's why I shared this this document with you, which is our, it's called Human Together. It's our department's brand new strategic vision that we just released recently. The only reason that I won't go into the detail on that, I just wanted to share it with you because it's fresh. And it also lines up really well with this though, because as the name suggests, Human Together really for us means that we can't do this work alone as a government agency. We probably shouldn't even be the primary folks to do it, but we need a community to do this work. And that's really kind of how we're seeing our work over the next 5 years. Hunger is definitely a big part of that. And so that's why I wanted to share that with you all. And so why don't I jump into the first slide here? So if you don't mind. So for the first one here, we have a map of Denver. And you'll see the darker green areas of the map show higher concentrations of SNAP participation. Mostly, I just thought this was a cool map that I wanted to throw in the presentation. It's relevant in that what we did locally is we mapped our SNAP participation, those that are currently enrolled, with some ACS data, some census data in terms of what we think, roughly people that would be eligible but are not enrolled. So the darker green, actually that's the next map. This first map just shows enrollment. So currently we have about 92,000 individuals, depending on the month, enrolled in SNAP. It's about $121 million in SNAP benefits. And roughly about 40% of those families or households have a child. 35% have an adult over age 60, and 70% are working. So those are just interesting statistics to share, just in terms of myth busting, I think, in terms of some of maybe the stereotypes around what a typical SNAP family looks like.
Where
Yes.
where are those statistics available? In which one of these documents? The ones
In
that you
the,
just,
in the reports, yeah.
in
task force report.
the blue-ish, greenish, purple.
This one right here.
Thank you.
And I can provide more if you'd like to, if you don't find it in there. So anyway, so this map again just shows kind of who's enrolled already. And we talk about the inverted L in Denver, by the way, which is roughly the northeast and southwest corridor being our higher need areas. So you'll certainly see that articulated through this map here as well. So next slide. So yeah, I was jumping ahead there a minute ago, but so this shows those that are eligible but not enrolled. So the darker green areas of the map show higher concentrations of folks that might be eligible but are not enrolled. And again, I think, if you follow the inverted L kind of thinking there, those neighborhoods that are darker would be both particularly along that inverted L, are those neighborhoods that maybe have a higher need and a higher population that actually aren't enrolled. So those have really become target communities for us to really look at. And as I mentioned earlier, being good timing, we also have a couple other city efforts going on in terms of increasing access to SNAP. There is through our partners at Denver Department.
Right? Is everybody okay as we just gotta do a thing?
Yeah, it's nice. The better mood lighting. So Denver Department of Public Health and Environment also has recently, well, not recently, maybe 6 months ago or so, I think it was last summer, released a Denver's food vision, which is very much all inclusive in terms of increasing opportunities for healthy food to be available in Denver County. But there is a very specific SNAP initiative with access to SNAP initiative within that as well. So that lines up really well for us. And so anyway, based on kind of the data that we see here, we know that about 64% of those that are eligible for SNAP in Denver County are actually receiving it. So, so finally, back to the task force then. So what do we want to do? What was the main objective of the task force? And what was really different about it too, by the way, from our work here at the Blueprint, is the Denver Task Force was very much focused on SNAP access and increasing that access in Denver County specifically. So trying to bring that up to 80% in about 3 years, and then to reach the ultimate goal of the Blueprint, which would be about 90% or in the top 10 states in the country in 5 years. So thanks. Next slide is, so back to the task force then. So we worked over the year's time and came up with the recommendations you'll find there in the report. This slide here just sort of provides different categories for those recommendations. So there was a focus on, for instance, the department. There were some recommendations, I sort of grouped these together as community, but they were foundations, nonprofits, et cetera. And then some recommendations for the state in particular. And I won't read all of those to you, but I just wanted to mention, particularly on the DHS side, what we're really focused on is a particular category around client experience. So in addition to keeping this as a mayoral priority, doing some really specific targeted neighborhood outreach, kind of grassroots, we wanted to look at our customer experience in terms of how we can improve that, because we hear pretty loud and clear through this and through other feedback mechanisms that people don't access us because it's not easy, or they don't even want to come into our agency. And so how can we meet people where they are, or if they do come in, how can we make it a better experience for them? So in terms of the client experience, we're focused on what we're calling feedback loops. This was feedback loops, or it was something that was recommended way back a couple of years ago when we were doing the SNAP into Health work in Denver, and we never really implemented that part of it. So we mean it this time, and we're going to do these feedback loops, which, by the way, feedback loop is just as it sounds, sort of a bi-directional communication channel for us at DHS to be able to tell people about what's going on with SNAP, and for us to hear from people in the community about what they need in terms of SNAP. So that's like the number one priority. That might manifest itself through something more traditional like an advisory committee, but it's also any and all other ways to be connected with folks. We know also that we need, I don't know if anyone's been in our Castro lobby recently or in the last 20 years. It hasn't changed really. We haven't changed the signs. We have cleaned a little bit, but anyway, it's we definitely acknowledge that we need some improvement there. So we are got some money set aside to do some revitalization efforts around our lobbies, not just at Castro, but particularly focused on Castro, and looking at our call center experience as well. So sort of the bricks and mortar and the virtual experience and how people navigate our programs. We're going to change that if we can. Communications, we're really going to focus, and one of the recommendations that came out of the report was to, although we are a part of the solution and trying to address client correspondence that comes out of the state CBMS system, we also know that we can enhance some of that locally by text messaging and other ways that we can hopefully work around some of the issues around statewide communication issues. And then finally, one of the recommendations around the client experience was really to, as part of that targeted outreach that we do in neighborhoods and communities in Denver, to really focus on specific underserved populations. So really understanding who those folks are and bringing some data to that in terms, rather than just making assumptions, and developing strategies to really meet different communities where they are, rather than have a one-size-fits-all strategy. So that is it for the SNAP task force. Anything to add, Sandy?
It was the partnerships.
Yeah, I think that was one of, not a lot of big surprises, I don't think, in terms of recommendations, but what I found at least was that it brought a lot of new and different people to the table to work on this stuff. So I hope I didn't take too much time there.
No, and we have some time for questions if folks have questions also. And folks joining us remotely, please feel free to pop in if you have questions you would like to ask.
You mentioned like Denver Scoop Vision, and we've talked a little bit about that. How do you think the leadership that's gone into that piece, which is different than the SNAP task force, can leverage the work that they're doing in communities and potentially fund SNAP outreach in the communities where the access is low? Because there are two systems. That's out of the mayor's office, right?
It's it was originally with the Office of Economic Development,
okay.
and then it was moved to Public Health and Environment,
Okay.
which is great. So it's been now
because they're sitting on some serious money over there.
Different systems, right? They're sitting on some serious money there. It's different folks at the table. It's caused us to remember to, and by the way, that's what our Human Together plan is all about, is getting outside of ourselves and our little silos, even within the city or our own agency. So working with our partners over Public Health and Environment, who have a different perspective, different players, different resources, same issue. So I think it's just bringing more diversity and more capacity to the same issue that we're all trying to figure out together. So.
Yeah. I mean, I've been to some of their meetings, and they're doing a lot on environmental issues and a lot on food waste. And I just wonder, you guys are the specialists along with your partners in outreach and enrollment and what's happening at that community level. And even as part of their plan, how do we work help you work across, or how might some folks in this group help bridge that, or is there a way to bridge that in support of your goals around enrollment?
Yeah, I think just helping us to make that connection, because obviously we've got the SNAP piece of it, but I didn't want to look at there's a singular or a group of recommendations in the food plan about SNAP access. I didn't want that just to be our only thing.
Yeah, absolutely.
Broader vision, right? And so, but food waste and other areas that's not necessarily our expertise, but it's great to bring that to. I mean, it's all part of a broader conversation. I think that although it sounds obvious to most folks in this room, talking about SNAP not in a welfare context but in a health context is a relatively new thing for us, right? And so, helping me make those connections, I guess, and that would always be helpful. So I appreciate the offer.
Because Lane is on one of our work groups, who's
right.
Yes. Kind of in charge of that now.
Yeah, that's right.
Lane Sadowski and Blake D'Angelo was on the steering committee. So it's really, how do we, since it's in both of your plans and there's some cross connections, how do we make sure that stays on their radar screen as an investment strategy, so that their support will come in from that direction as well, so you guys aren't in this alone.
That'll just keep us honest, I think, and if rather than just see each other at meetings, a couple times a year, remembering that we can be working more consistently on the same stuff.
Well, I'll start asking her really hard questions.
Yeah, that's my second.
Just kidding.
I had a very specific question for everyone else following along. This is on page 16 of the report, recommendation number 9. This is the second bullet where it says, explore ways to ensure that everyone who provides requested documentation in person or electronically receives a receipt to note that the documentation was provided. And I was just really excited to see this included in this report, because I thought relatively low-hanging fruit, but it can be crucially important for people who need to preserve their date of eligibility. And I was just wondering if you might be able, either now or later, to provide a status report on this particular piece of the recommendations.
Sure. Yeah. Thanks, Jack. I think that this was kind of part of a broader conversation about first of all, just looking at we want people to tell their story once and not have to tell it repeatedly, and so looking at some systems that might be able to, some integrated or interoperable systems that might be able to support that. At the same time, also understanding what a burden it is for people that have to tell their story more than once, and related to that, share their documentation more than once, because we are very much still not as integrated as we would like to be, right? And so there are some conversations moving forward about what developing that interoperable system, and we're looking at Boulder County and some other examples as well. And I think that developing the receipts, and more importantly, some navigation guidance through that system is going to be something that's kind of earlier rather than later, in terms of developing that. Now, we don't have to wait for that, though, in terms of actually giving people a receipt, no matter whether it's through the system or wherever they provide that documentation, is something that we can work on outside of that. And so that is not something that we've developed yet in terms of procedure, but we are looking at it. So.
Okay, well, I appreciate that. I guess our particular concern, especially, is with the in-person documentation, where sometimes that will get lost and someone has to apply again, brand new. And so if there was any low-tech stopgap solution, just like a rubber stamp, anything that we could do to help facilitate that, let me know, and be really interested in seeing how this recommendation progresses.
Jack, do you see differences in counties?
Yeah.
Because I know Denver's got a good work management system, and a couple other counties have good work management systems. Are you able to track which ones are kind of having more heartburn on that for clients?
I believe there was a survey. If Terry's still on the line, she might be able to speak to this better, where one of the questions that was asked, it was a survey of counties, and they were asked whether or not they provide receipts for documentation, and it was all over the map. Some are, some aren't. So there's no uniformity, unfortunately.
Yeah.
Some upon request only, some automatically.
It's harder though when it's uploaded, right? And they go into a work management system. So I didn't know if more complaints came in for counties that have a lower technology or higher technology.
That's a good question.
Yeah, that's a good question. I'm not sure.
Yeah.
Yeah.
Might be interesting.
This is very, yeah, we did release a SNAP resource guide, which had that information. I would say from what we hear about, lost or missing paperwork, it's sort of evenly dispersed, actually.
But I would say that maybe the cases of lost or missing paperwork are fairly evenly dispersed, but when you have a receipt, you have recourse as a client.
Yeah, absolutely.
And so that's why I think even just having those receipts will help us start to figure out where it's actually happening, because right now that's pretty hard to track.
Absolutely.
I think receipts will help us too, just because sometimes we don't know where where the link got delinked in our own system. It's just a matter of, I think, how we do it, and particularly in these systems in busy counties where every minute counts in terms of our process. It's what's the fastest, most efficient way for us to generate information that'll be helpful for both the client and for us, and still get that benefit out timely and keep things moving.
So carrying around pieces of paper when you are not housing stable is an issue. So whether it's date stamped or not, paper blows in the wind. And so I would, as you all are contemplating, be aware of that. I would think exploring a public-private partnership with Logitech, IBM, anyone who can do the tiny a thumb drive or something that digitally snapshots the date as well, but that it is easier to carry, easier to hold, to keep track of, put around your neck, put on, a little wrist thing. So as you are thinking about solutions, really be aware that many of the folks who depend on this have instability in so many other places that,
I know I lose paper too. So,
Yeah.
So definitely.
There's a bunch of it lost in my car right now.
Our system is pretty sophisticated in terms of tracking documents, and I think when these things happen where we lose track of something is more when someone's accessing maybe they talk to someone at the self-service center, or there's some confusion where it's not part of our regular process. So a lot of it is just really just taking a look at our processes and making sure they're as tight as well. But definitely I understand generating a receipt is also helpful.
It's also helpful for redundancies. If you have to give the same information somewhere else, if you move counties, if you move somewhere, to be able to just say,
Right.
Here it is.
Yeah, and I think that the receipt can also be a tool for developing the right business process, because ideally generating that receipt is captured within your interoperable system. So anytime someone has received a receipt that also lives somewhere in the cloud, I don't really get how those things work, but
In a thundercloud.
yeah, in the thundercloud.
A storm cloud.
And once people are in the system and verified, even if they move counties, they don't have to bring in the information again. They just need to bring in income again. So there is some technology behind the scenes that I don't, this is pretty complicated to understand.
So I just want to call time too, because we have some other stuff. So Todd, just a couple of follow-up things. So if folks want to sort of track your progress or understand sort of what's happening and moving forward, how can they best sort of follow this work?
I think there's a question.
Monica's got a
Yeah, we have
question.
from Monica. Do you think we have time to get to this really quick?
Yes, because I have had my back to them. So.
Okay. So Monica asked, I'm interested in learning more about the client feedback work. What are the benefits of this work for your associates / employees, for the people who are struggling to put food on the table consistently?
And I'd be happy to would it be best if I connected with Monica on that offline? I think there's pretty pretty extensive answer on that probably, but yeah, and I think that might get at your question too, just in terms of ongoing. I don't know, would it be helpful to, I mean, I can provide updates for this group, just
I don't know if there's anywhere online that you're sort of tracking, like, you know, in the next 6 months we hope to do this as an accountability thing, or if it's really that people would have to call you to get that information.
Yeah, I think it's part of that feedback loop that we
Okay,
need to
great.
develop, right? So
Great.
TBD.
Yeah.
But, yeah.
Thank you.
Is that a question?
Yeah.
Okay, perfect. Thank you. Thanks, Todd. That's really super. I'm looking forward to reading the whole report. Okay, great. All right, so our next group is WIC, or Outreach and Innovation Work.
All right, so I'm Eric Hendrick. I'm highly confident in the agenda, but sometimes more for
Can you folks on the phone hear?
Can you guys hear me? Okay?
Yes, we can.
Okay, great. Thank you. Just wanted to double check.
So I'm presenting for Heidi since I'm on the Workgroup, and it does say WIC Outreach and Innovation Grant. Those grants are in progress, so we don't have a lot to share, but I will touch on that. But we thought we would just provide an overview, let you know what's new with WIC and some of our current outreach and enrollment efforts, in addition to the grants. So I don't have control, but next slide,
Yep.
please. Thank you. Again, just providing an overview, letting you know what's new and outreach and enrollment. Okay, so what is WIC? WIC is the special supplemental program for women, infants, and children. It's federally funded nutrition program, and the participants, we call them WIC participants, are pregnant women, postpartum women, up to 6 months after the baby's born if they're not breastfeeding. If they're breastfeeding, then up to a year after the baby's born. And then obviously infants, and then children up to their 5th birthday. Over half of all infants born in the U.S. are on WIC. So that's an interesting fact. And then also, WIC is for every family that has a child under 5 in the household. So foster parents, grandparents, anybody who is a caregiver of a child under 5 can apply for WIC. The child receives the benefits, you know, the grandparents do not, but of course that is food in the household, so that's helpful. And then of course WIC benefits are free. Participation in WIC has been shown to yield better birth outcomes, increase breastfeeding rates, increase key nutrients in the diet, and help ensure adequate growth. And a USDA study shows that for every dollar spent in WIC, there's $1.92 to $4.21 savings in Medicaid for newborns and their mothers. So. Next slide, please. And then our core services is that we provide nutrition education, healthy foods, and then breastfeeding support, and also breast pumps. A lot of people don't know that we provide breast pumps. And then referrals to healthcare and other resources. And we provide these again to women and children through critical times of growth. And then in Colorado, we have over 100 WIC clinics throughout the state. And on average, we serve about 80,000 participants per month. We serve every county. We don't have a WIC in every county, but we serve every county. So location-wise, you know, if you live in one county, you can go to the closest WIC clinic to you. You don't have to be going to the clinic in your county or in your specific zip code. So whatever works for you. And then on our website, we have a clinic locator map, so you can find dates and times based on your zip. Eligibility overview, and again, I know most of you all probably know this stuff, but just in case you don't, we have 3 criteria the applicants must meet, and the first one is categorical. So again, pregnant, or breastfeeding mom, postpartum mom, infant, or child under 5. Income. So if someone is currently participating in Medicaid, SNAP, or TANF, and we can verify that they're currently active, that would serve as their income. Reduces the need to bring in checks, pay stubs, and gathering all that fun stuff, which is challenging to find. challenging to carry around. So if we can verify that, we're good. If they're not participating in any of those programs, then the household needs to make less than at or less than 185% of the federal fund. And then they must live in Colorado. It doesn't matter how long they've lived here, and they just have to show proof of address. We have a policy in case they don't have a proof of address that we can work around, like a workaround policy. We don't ask for citizenship or visa status or anything like that. So just need them to live in. And then also, if they don't have proof of income, we also have a policy we can work with them on that. But proof of ID, we do. That's the most important. And yes, again, we take proof of ID, proof of income, or participation in WIC, SNAP, or TANF, and then proof of address. So those are the proofs we ask for, and I know they can be challenging. So that's one thing we often hear, obviously, is the proof piece and the documentation. So we always try to find ways to decrease those barriers. We're always open to ideas. Next slide, please. Thank you. Oh, yeah, and if you do have somebody you want to refer to WIC and you're just unsure, still refer them, and the clinic will pre-screen them and save them time. Just to make sure they're eligible. So you don't have to remember everything we're saying today, but just send them our way. We'll take care of that. Next slide. So over the last few years, we've been doing a lot of modernization because WIC's just a little bit behind in catching up with technology. So we've done a lot of changes to decrease barriers, improve access, and make the program easier. Some of these are mandated, like switching from the WIC checks to the EBT card. So we have an EWIC card, which is a card. That is a mandated change, but we've made it. Some states are still in progress. So we did that 2 years ago. And that is a lot easier to use. Families don't have to buy all that food at one time, and they can carry around checks. They can buy their food throughout the month when they want. And it also makes it easier and more discreet at the store. And we released the shopping app, the WIC Shopper, and they can scan products, make sure they're WIC approved. They can check their benefits on their phone. So it's been really actually quite helpful. We've heard really great feedback from clients and staff as well. We've also created something called Education Choice. So clients need to come in for a certification appointment. 3 months later, the family typically has to come back. But for that 3-month follow-up appointment, we've asked them, would they rather come in the clinic, have their appointment by phone, or do a in-person lesson online and lesson of their choice, a topic of their own interest. That way, they don't have to come in the clinic if that's their choice, drag all the kids in. It be seen. We know transportation is a big barrier. Finding time, taking time off work. So this makes it pretty convenient for them. So we rolled that out about 2 years ago. And then we also text appointment reminders now, which helps with show rates. It's a family plan. And then we have a new website, so which is pretty. Next slide, please. So outreach and enrollment. Nationally, WIC has been, participation in WIC has been decreasing. And since 2009, it's been steadily decreasing in Colorado as well. But it has pretty much stabilized since 2016. And that's actually the year we rolled out a lot of those new initiatives I just talked about. So we haven't done any direct evaluation to say it was this, it was that, is it everything, but we're hopeful. There probably will be some evaluation on that. We want to determine, what was the most effective, where do we need to strengthen some of our outreach and enrollment efforts. But so it's pretty much stabilized. But again, we still have a long ways to go because we only serve, as of 2015, 41% of the eligible but not enrolled individuals. So
what percent was that?
41.
41.
In 2015. So it should be. Yeah, so that's what we do. Next slide, thank you. And so the WIC Innovation Grant, so in 2017, Colorado Health Foundation released the WIC Innovation Funding Opportunity for local WIC agencies to implement proven or community developed practices to improve participation through enrollment and or retention efforts. I'm not involved in those work groups in regards to coordinating the efforts, but obviously I'm on the team, so I can hear all about them. But we do have 12 local agencies that are participating throughout the state. And really the main activities that are going on with the grants right now are either co-locating, so maybe within a provider's office or a community partner's office, creating a new clinic, so a new site in an underserved area, mobile clinics, so actually having a van and kind of moving around, which is kind of cool. And then improving communication and marketing messages, targeted outreach. Those are the most common things right now. Targeting childcare and Head Start clinics. Again, maybe co-locating at a Head Start or trying to have appointments at the same time. Making it easier on the family because if the family has Head Start, then income-wise, they would qualify for as well. Yeah, so currently, Kaiser will be evaluating the grants, not individual grants, but the efforts at large. The grantees, the 12 agencies that are participating, will be evaluating their own efforts. But every month they have a learning community, so each of the 12 agencies can jump online and talk with each other about what they're doing, stumbling blocks, successes, and just really sharing with each other. And I've attended a couple of those calls, and they're really awesome. I mean, your brain just starts moving, and you start getting a lot of ideas, and everybody's going to jump in. So I think it'll be really interesting. Some of the efforts are going to be very individualized because the region. What works in Montezuma might not work in Denver. But, again, it'll be a learning curve. But it's definitely, I think the learning community is going to be really helpful. But anyways, Kaiser will be evaluating that. Participating agencies are Boulder, Denver, Eagle, El Paso, Grand, Jefferson, Montezuma, Pueblo, San Juan, Summit, Weld, and Tri-County. A lot of different counties there. And then the grant cycles were June 2017 through June 2019, and October 17 through October 2019. So still in process, but kind of excited to hear about what works. And actually from the grantees came about a request for a statewide referral form, so we'll talk about that. But they had been wanting it to be easier to refer to WIC, so they were creating individual referral forms for Jefferson County, and then Tri-County had one. So having that is kind of it was good. It was a good start, but we really wanted one statewide because then if you're a provider referring to another county, which form do I use? So with their ideas, we released our form, and so now statewide form. I'll talk about that in a minute. Other outreach enrollment efforts we did as well is last summer the state office conducted regional tours throughout the state in Alamosa, Broomfield, Cortez, Denver, Broomfield, but it's Broomfield because it wasn't there. Eagle, Fort Morgan, and La Junta. And the goal of the regional tours was to interview staff, WIC staff, and current participants from counties all over the state. So we're in only 7 spots, but we had staff come from those other counties. So, if you lived in Baca, you could go to Otero or, whatever worked for you. Same with participants. We asked the clinics to help recruit staff or participants because they did key informant interviews and focus groups to find out what's going well in WIC, what are the pain points, and just help us identify, different strategies and initiatives that we want to focus on. So, the shopping experience is always challenging, we know that. And hearing it from both staff and WIC lets us know what else do we need to do. It's never going to be perfect, but, just we're gathering that feedback and it's being analyzed and evaluated as we speak. So, it'll be interesting to show. But that will also, like I said, help inform our initiatives and, you know, really focuses on retention, making the program easier and more accessible. So really valuable info. Another pilot that we have participated in is with the Benefits Data Trust. I don't know how there's on the phone. So what we did is we partnered with them and the Center on Budget Policy and Priorities, I always have to say that, CBPP, to pilot out using texting for outreach to SNAP households that have children under 5, letting them know they may be eligible for WIC, and if they're interested, they could respond, and then the information would go to inbox, online, secure, and that the agency that serves them typically would contact them to follow up and pre-screen, schedule an appointment, and then if that wasn't their location of choice, provide them the information. So that started in September, it ended in January, it's being evaluated right now. So that'll be really interesting. And we did it with 7 agencies throughout the state, some big, some small. So Tri-County, which encompasses 4 counties, Denver, Pueblo, Mesa, Northeast Colorado, so 6 counties up there, and Jefferson. And again, the pilot's being evaluated. So we'll share that with us for me. We're excited to get that hopefully by early March, we should know more. And then the cool thing about that is we got to work on data sharing agreements between, you know, different agencies, so CDHS, CDPH. We got to look at the behavioral piece, like texting piece. So which messages resonated more? Where did you get more responses? So kind of testing the behavioral piece. And then we also developed, created an inbox online and the referral process. So I worked on that one. And the next one is Colorado Peak. A couple of years ago, March 2016, we were integrated in the Colorado Peak online application. So people can mark that they're interested in WIC, submit information. If they're categorically eligible, get their information. But if it was a single man in his 60s with no kids in the house at all and he applied, we won't get his information. So that was good. So the system was really well designed to help be really efficient for our agency, so they're not cold calling people who are not technically eligible. Most of the people who are using Colorado Peak maybe are applying for Medicaid SNAP or TANF, so we know if they get that, then they would qualify for WIC if they have a child under 5 or they're pregnant in the household. And then we also were able to use Peak if they have the app. They can pull up their account, they can show that they're active, they can use that as their proof of income and stuff like that. So that was kind of a win-win. We get about 1,400 referrals a month. That does not mean they all enroll. There's a lot of phone tag, a lot of trying to get a hold of people, but that's a pretty good number so far. So it's been going on since 2016, so we're in there. And then because of the grantee efforts with the WIC Innovation Funding Opportunity, they asked us if we could create an online referral form statewide. So we debuted that early December. And Colorado WIC sign up is super short, super easy to use. This is really geared towards community partners, providers, potential families. Of course, there's the Colorado Peak application too, but this is short, sweet, and easy. If someone's not planning on applying for Medicaid or TANF and filling out a lot more information. And this is the same concept where it's routed by zip code to agencies that typically serve. Somebody applied for WIC here, and they were eligible for SNAP. Yeah, so part of what we do at WIC is we want to refer back and forth to Medicaid, SNAP, or TANF. So if somebody's eligible program, that would be beneficial. Remember, we don't have an online referral towards, SNAP, but it's a verbal referral, unless the clinic, depending on the local agency, would have a pretty good working relationship. We might be in the same location even, so sometimes it's literally the office next door. Some people just come over, so it just really kind of depends where they're located. But yeah, we don't have a feedback loop electronically per se. That makes sense. interesting. So yeah, that is just new, and so it's going to take word of mouth. Make sure we keep it up, keep it out there, keep it alive, and add in posters and outreach stuff. And we'll be evaluating it and providing some of our statewide partners information on aggregate, like on the number received from that this is referred by, and how many of those. So I'm trying to create that feedback loop, not on the individual level. And yeah, you can refer to it online, by phone, cover a week.
A couple, well, first, the online referral form is, I think, going to be a game changer, so that's awesome. Congratulations on that. Are you able to, so we know generally how many people are on Medicaid but not on SNAP in Colorado that are eligible. Do you guys have that sense? Because we've got a 95% participation rate in Medicaid, right? And then we've got this kind of problem on the food side in every program. Do you guys know how many right now are eligible but not enrolled?
We have the 41% from 2015, but I know they were working on a new methodology to determine that rate, so we don't have that information now. But Alex, we have a data evaluation manager now, which is awesome. So kind of, we obviously need more recent numbers.
Yeah, we were able to get it by county, which I think like a numbers, the actual numbers we have to be able to do. And then, do you guys have view-only access into CBMS? Because then you can verify.
Awesome. No.
That should be wow.
Yeah.
There's hospital systems that have read-only, and I think Congress Free has read-only. So
I think they're working on a tri-agency, and then we have a quad-agency data share agreement going on, and I think that might be part of the quad. But we do have some agencies that can get into Health First Colorado, the online portal, and check verification.
Right.
But that's just for Medicaid. So CBMS access.
Yeah, again, Medicaid's got your 95%, but yeah, so yeah, I think any of those where the customers aren't having to bring their paper around for sure. But congratulations on the awesome work.
Jennifer, gapmap.org has a breakdown for each county about the eligibility rates for SNAP versus WIC versus Medicaid versus TANF. So it's a little dated now.
Yeah,
too.
it is. I've got some interesting information for you.
Quick, thanks. That was really helpful. That was very informative. I just wanted to follow up on Jennifer's piece real quick too. So our partners at Denver Health, who are actually the West Side Clinic, are actually across the parking lot from us, and we haven't really been working as closely as we could have with them over the years. But they reached out. I think it might be, I have to admit, I'm not sure, part of the innovation grant maybe that they got, that they had reached out and just wanted to explore ways for us to better partner. From that, we have a WIC person that's in our Castro lobby now 2 days a week, just on site enrolling, and we're doing sort of warm handoffs from our eligibility staff, and that's been really helpful. I think we were all just really thrilled with that setup. As part of that conversation too, I think it was about 6 months ago, we started a conversation with our with the folks at CDHS about sharing data across WIC and SNAP, and at least some of us at Denver County, our interpretation of the federal statutes around this would allow us to do that pretty easily because they're both part of a USDA program. But I think there was some hesitation at the state around, and maybe that's what this tri-agency agreement is about now, but it seemed like it kind of stalled. So maybe I know I could get back on that and see what we can do about that, because I think that would really be helpful. And there's some really quick, easy ways to look at that to determine strategies.
Any questions from our folks joining us remotely? Didn't type anything in.
Not yet.
Okay,
Thank you.
great.
Thanks.
Hey, Mandy.
All right, well, this will build on both Todd and Aaron's presentations. I'm going to talk about the health partnership in trying to maximize enrollment in both SNAP and WIC. Okay, you can do next slide. So obviously the opportunities here are that we do know that SNAP and WIC improve health, economic and academic outcomes, and we just heard how under-enrolled we are in WIC. We know that food insecurity in Colorado is prevalent across and has the lifespan and has negative impacts. We also know that Medicaid beneficiaries are likely eligible for both SNAP and WIC. And so what I want to do is pick everyone's brain on how to better develop interventions that will maximize enrollment in SNAP and WIC. We just got the data last Friday. Jennifer helped me get it on current Medicaid enrollees who are enrolled in SNAP, and it's 54%. So we have over 700,000 Medicaid beneficiaries whose households are not enrolled in SNAP, and we can't get the WIC data. So, you know, and we'll go through why I think it's important to develop certain outreaches. So next slide. The health community took a while, but I think there's now growing awareness. It's sort of for everybody around the table, no duh, that food insecurity is associated with poor health, higher prevalence, and poor management of chronic disease. A lot of that is food insecurity is associated with poor diet quality. The stress from not knowing where you're going to get the next meal drives chronic illness, makes it difficult to manage. And then the treat or eat. In the United States, 1 in 3 adults with chronic illness struggle to either buy food or medicine. And so often there's trade-offs, and that obviously isn't good for your health. And we know that food insecurity is associated with higher healthcare costs. Next slide. I think not, and I'm glad people brought this up. I think there isn't been as much attention to all the health benefits for both SNAP and WIC. The SNAP participants report better health, especially early in pregnancy when they rolled out the food stamp program. They did it county by county. And so they could go back and look at outcomes. And people that were enrolled while the mother was pregnant or in their infancy actually had a decrease in metabolic syndrome. And that's what drives both heart disease and diabetes. So again, a really preventative health strategy that we don't hear enough about. We know that elderly patients who are on SNAP take their medication more, and we know it's associated with lower healthcare costs, lower Medicare and Medicaid. On WIC, I think, next slide, Erin went over a lot of the data, so I won't dwell on that. Next slide. There have been more, in the past 4 years, more organizations have asked for promoting food security for all children and households with children. The American Diabetes Association has come out for, at first it was consider food insecurity in the context of hyper or hypoglycemia, and now it's consider it with all your patients. And then there's also a framework for state Medicaid programs to address food insecurity. To date, most of the research is, or most of these physicians are saying to implement food insecurity screening and referral. So figure out how to ask all of your patients if they're struggling to afford food. And if so, develop a referral network. Easier said than done. Next slide. So I'll tell you about some of the work in Colorado. This was the Medicare Total Health Assessment at Kaiser. So every year, if you're over 65, you're given a health questionnaire about a multitude of things, and there's been a food insecurity question in that assessment. And over 50,000 Kaiser patients were screened over 3 years. The overall food insecurity prevalence was 5.7%. If you had Medicaid, it was 25%. So obviously a population that makes sense to target. Interestingly enough, if you just focused on the Medicaid, you'd be missing half of the patients because there's more people in the other group. But so you still need both tactics. And no surprise, food insecure adults were more likely to report poor health, poor quality of life, anxiety, depression, and frailty. And it was also associated with severe obesity in the elderly population. So I'm going to then talk about work that Monica Bulick started with Hunger Free Colorado. And we were really lucky in the state to have one organization that was statewide. As Erin talked about, having county-focused initiatives can be incredibly problematic for healthcare delivery system. When I worked at the Lakewood Kaiser, we had 5 different counties, so you can't keep those resources straight. So this was a game changer, and many states have modeled after Hunger Free. How do you have a complete solution where you're beginning applications for SNAP and WIC, and you're also connecting to all other food resources. Next slide. So this is the result in 2017. We looked at how well were we doing at Kaiser in with this partnership in enrolling households in SNAP. We wanted to do households in WIC also, since they're the 2 most sustainable food resources, but we didn't have the WIC data, and that and Hunger Free couldn't get the WIC data either, so nobody at that point could give us that. So we just did the households with SNAP. The first box you can see that Hunger Free reached 80%. That's pretty amazing, because again, Monica was smarter than I was and started measuring when we gave patients initially who screened positive for food insecurity. The households that did in the pediatric clinics were given a Hunger Free Colorado card. You just call this number, they'll be able to help you with services. And Monica and Hunger Free tracked, and 5% connected with services that way. We redid that experiment with the elderly, and it was 2.5%. So having Hunger Free outreach identified patients and doing it in a really timely manner was a game changer, and it connected 80%. So Erin talked about, and Todd, the need for warm handoffs, and this just speaks to the paper or just go refer doesn't work when you have people that are overwhelmed, stretched for time. We need to help. Now you can see the numbers start to really drop off. Only 35%, so we weren't able to see everyone that was eligible, but 35% were eligible for SNAP. And so you look back and say, okay, was Kaiser sending the right number of patients? Were they focusing enough on Medicaid beneficiaries? Because that would have bumped that number up. And then the next step is, as a result of taking those eligible, how many had applications? So there's another huge drop off that only 13% completed applications. And then again, only 6% were enrolled. Now that number has increased to 8% in the last 6 months. At Denver Health, it is about 10% and Children's 12%. In other states, the application to enrollment is 75%. So, you know, looking at what are all the, I think what this data helps highlight are what are all the things we need to do differently to get that enrollment up. And the other thing Hunger Free did was work with our evaluation, the Kaiser evaluation, to understand with our Medicaid families, households, how well were we doing from a customer service standpoint too. And one of the points they came back with where there were so many handoffs, they didn't know who was calling them. And so you think about it, so you have in the clinic, the diagnosis is made, well, I'm going to refer you to our community benefit, our community liaison team, who then refers to Hunger Free, who then refers to the state. So there's way too many drop-offs. That's another reason for the drop. So how do we develop a leaner process? And what are people's other thoughts on what you would do differently here?
Do you have any other feedback from folks besides like all of these different entities being in touch? And do you have any other feedback or any other data that helps you understand where folks got lost in that?
No, we didn't have a high enough power, but that's exactly what, and that's what Denver Health was talking about, is trying to, with patients, do their lean process and figure out the different steps where people, and I think one of the, obviously either Hunger Free or Kaiser needs to follow up on the applications that are completed that didn't result in enrollment. So how do you bump that up, and what are the policies that are preventing that?
If you me a question, like, is application assistance needed, or is that?
Right,
I mean, that's,
right.
So I can speak a little bit to the 13 dropping down to 6.
Yeah, I mean, that's the number.
Yeah, so I'll also say, I mean, that 35%, we have a lot of clients who decline to even let us know what their income is, if they might be eligible. So I would guess that 35% is really higher if we were able to get all that information, but we're never gonna really like dig that because we're, you know. But then once someone decides to do an application, we do application assistance. So we actually complete the application for them. We get a telephonic signature, which means we read them their rights and responsibilities. They give us permission to sign for them through PEAK. So then we submit their application through PEAK, and it goes into their county's inbox. So at that point, we can't really touch that again in terms of processing. We absolutely follow up with clients, but we can't determine eligibility. We can't do an eligibility interview. And we can't process their documentation. All of that has to happen at the county level. So there's yet another handoff, and it's not necessarily one-stop shopping for them to finish at that point. So they're going to get a phone call in most cases to complete their interview. If they miss that call, they may or may not get a voicemail, depending if their voicemail is set up and says their name, so that an eligibility technician knows that they're not leaving confidential information on a random person's voicemail. They could try to call back, but they might get into an hour-long queue in a call center. So you already see that's another point where it could take 3 to 4 calls or going into an office for someone to complete their interview. And then after that, or this could all be sort of it's not necessarily a linear process depending on how someone chooses to do it. They also are going to need to hand in verifications. We can give people a pretty good idea of what they need to hand in for verifications, but we don't have full CBMS access, which is where the eligibility, that's like the system that the eligibility data lives in. So we can give a pretty educated guess of like, okay, you have new income, you're going to need to provide proof of that. People can send it through us. They rarely do, though, especially with phone calls. Sometimes when we're doing in-person outreach, that's easier. So often that means either mailing it or uploading it themselves to Peak or bringing it into an office. So that handoff, I think we're up to like between 60 and 65% of our applications now get approved. But that's, I mean, even if we're calling and doing follow-ups, I think because there are so many steps once you hand it off, that's what we really struggle with. And are also open to ideas and thoughts.
Yeah, I mean, this data is very similar to national data. So you get you get about 50% from an outgoing call, right? Or which is pretty much what you have, and then between 50 to 65% are then going to get enrolled. So this is pretty standard business process. What I think is different when you have in-person is you're looking at about a 70%, and you're not looking at the drop-off, right? You're not looking at the 2 drop-offs. So that's where this model becomes, you're only going to get this percentage with that model, or with even BDT's model is very similar, right? But you know what you're going to get from that. And so that's why like the multiple models of face-to-face and on-site and community-based, you'll get a different number, but this is what we're going to get from calling, for sure.
Yeah, and I think what we're trying to dig into a little bit more is figuring out, okay, so after we hand off to counties, what's actually making someone ineligible? Is it that they're not getting the interview completed? Is it that they're missing a specific verification? Is it that their address and their phone number changes? So that we don't quite yet have a great way of tracking that, but we're trying to look into ways of actually determining what's the barrier that stops different people. Are there patterns in that?
Has anybody at this table been through this system?
Been through it?
Gone through this eligibility system? Just asking. I have. So I can answer a lot of those questions for you. Yes, the address changes. Yes, the phone number changes. Yes, I had to leave the appointment. If the person was there, and I'll tell you, UCD saved me, the Med Center, CU Med, saved me because somebody was there. So when I got actually at the top box, they said, walk around the corner, go sit over here. It will not be more than 10 minutes, we promise you. And you will sit face to face with someone. And they will tell you this, 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 and this. If I didn't understand it, they went back through each time, made sure that when I walked out, within 40 minutes, I knew every single step, and many of them were checked off before I left. So all of the rest of that didn't happen. So this is something that's really important. Let me keep reiterating in each of these work groups. If you sit around and continue to ask yourself the question and you can't answer it, then you don't have the right people at the table. Because that's really simple. And having been through it twice, and having walked people through this system now, because I have walked through it and understand it, and aside to the Center for African American Health, which does that for a lot of folks in the community, that's where the fall off is. The fall off is, I'm sick, I'm at the doctor, I'm here now, I need food now, I need this now I need this. When I go home and I'm not feeling good and I maybe did or didn't get my prescription, that's not coming back. It's not going to be any kind of a priority for me. But I'm there, and so I think that this is sort of what you're talking about when you're talking about the in-person help, experience, but in-person now. In-person now.
Right. So I just want to be mindful of time, and so.
Quickly go to the next slide.
Yep. And yes.
So that so a good point is what we're trying to do is say with this healthcare toolkit for promoting food security is encouraging enrollment of all Medicaid beneficiaries in SNAP and WIC, and not even ask about food insecurity. It's, are you enrolled in these programs that will benefit your health? So hopefully, but then how do we have the state agencies and the streamline, how do we have for WIC, for SNAP what we have for WIC, the easy referral, because people on site at healthcare often don't have time to do the peak application.
So that's where I think you need to talk about is getting somebody out of Castro.
We are.
And
Yeah, Sandy and I are talking about, I know for the sake of time, but I have lots of thoughts
Yeah.
here maybe we can share next time, but we're talking about some different options, including having one of our folks on site at the healthcare setting.
And then they do the interview, they do it.
We do have a much leaner in-person process than we do through Peak. Peak is kind of becomes sort of a black box. once it goes
Yeah,
through
and
that.
just like Erin was saying, the WIC portal is so much, now online portal is so much simpler than Colorado Peak. Colorado Peak works for Medicaid. If we had Get Cal Fresh and an online on-demand interview, everyone at every hospital could do this and get everything done. But with the current technology,
do it.
we can't get it.
right, and do it right
Right.
away.
Okay. That's
Great, thank you, Sandy. This is helpful. It's great to have the information, to see tracking and all of that. Thank you. So I know you just want to touch briefly on Mesa County.
Well, Kim, are you, so Michelle and I have been texting back and forth. Did you want to go through the Mesa County piece update, or I offered to push her to March?
Yeah, I just will say we have 15 minutes left, so I don't want to cut it too short if it's really helpful information. And we have a couple of other things I'd like to try to fit in today. So I think this probably deserves more.
I think so too. Yeah, I asked him to move to March. If they could, so.
We did have a comment or question from Monica in the chat. So she wasn't in the last work group. She's filling in for a colleague now, but a couple of meetings ago is highlighted that may be good for work group participants to try and get through the system. Todd, do you have maybe an ethical way that this could be done, or anyone else?
It's not unethical to apply. If you're ineligible, you're going to find out you're ineligible, but it's not unethical for anybody to call and apply other than you're taking somebody's time.
Right, you can apply, but you'll get screened out. You won't have any interaction with an eligibility technician.
That's
unless you lie about
true.
your income. Yeah.
Yeah,
Which
and you
then
don't
is
want to
fraud.
do.
Yeah. Yeah, you can't click the button and lie about your income.
Well, just to clarify, she's right. Anybody can apply, even if you're over income, you can still submit an application. And you are still required to have an interview before anyone is denied for eligibility. So you would make it through the whole process.
I would hesitate to, because those folks are really, really busy though, and we actually are trying to get people assigned. But the theme, I think, behind the comment is have some experience. Is that what you were saying, Monica, or can you clarify?
I mean, I can suggest, this doesn't cover everything, but you could certainly try to do a peak application and just not hit submit. That's pretty challenging in itself.
It is.
And that could be educational, just to realize how much is asked and how, like, wow, does this really apply to food assistance? Probably not in your case, but you're still asked it and you have no way of knowing.
Yeah, it's a nightmare.
So that could be a good start of that.
Super, thank you. So we will loop back with Mesa County at our March meeting. Is there anything you wanted to?
No, I did. Well, it's a couple of things. So it's been really great to travel around the state and stay connected with counties that are a little bit out ahead. So obviously Denver's been out ahead of the curve on SNAP enrollment efforts. Mesa County has been working on this for almost a year, convening groups and trying to figure out how to get volunteer application sisters out in the community. And again, they're giving us some information about what they need. And I think it helps inform what this work group can do, which is better technology other than peak, and easier training, right? So if we want people to do stuff in the community and we're training on peak, we're losing them right there. If we have better technology and easier training, or maybe even some workarounds, then communities that are planning for this are going to be more successful. The other theme, and I'm sure Todd would agree, and May said, certainly what I heard in Garfield last week was they don't even know how to talk about SNAP and WIC in a way that is life affirming and health affirming. And so really looking at messaging and marketing about the programs. And again, this could come as suggestions from this work group to start moving on. So that would be my just update from the field.
Great, thanks. We've got about 10 minutes left, so you've gotten a lot to absorb today. We'll make sure that the information that we can share from these presentations will be up on the website with the meeting notes, as we always do. So if you want to revisit any of this information, we'll have that available for you. And consider to continue to have this marinate kind of in your head about sort of what you've heard, what's helpful, what you might be able to amplify in your work, where do we feel momentum, all of those pieces, and we'll get to that. So in March, we're going to have some similar kinds of presentations for information sharing from folks, and then figure out how we want to bring all that together and sort of move forward in our April meeting. So that's what to expect next month in April a little bit as well. So I know Alexis had an opportunity she wanted to share with the group as well. That's a little bit tight.
Yeah, excuse me. This is pretty transactional. I just wanted to open it up to the group, but I'm sure some of you are already in the loop on this. But the U.S. Department of Agriculture has put out a proposed rule to narrow criteria by which states can exempt certain SNAP beneficiaries, ABODs, able-bodied adults without dependents, from existing program work requirements. They are seeking comment letters. I'm guessing some groups around the table maybe submitting comments. I know the Health Foundation wanted to submit comments. I just wanted to see if there was any appetite in potentially doing a shared comment letter with this group or with the Blueprint partners more broadly. And I would offer to draft something that would be more, the Health Foundation probably wouldn't get too much into the technical weeds, but it would be more just a general statement of opposition of don't make this any more challenging than it needs to be for clients. But I just wanted to see if there was appetite for that from those people.
I think submitting comments and sending letters to our representatives and senators. So having language for all of us to be able to do it individually and collectively, I think would be awesome.
And I was curious if anyone else is planning to submit.
Yeah, so we'll definitely be submitting comments. I sent Kevin our action alert, which has a link to a comment microsite where you enter your information and it links automatically. We have several templates that it's rotating through, but it's really important that there are as many unique comments as possible. So please use our microsite, but you don't need to use the template at all. You can delete it all and write in your own thing. That's even better. But also I think it'd be great to get a blueprint statement, but also the more individual, organizational, and participant comments that we can get, the better. And if you have ideas about making that easy for people to submit, please let us know. And if we can, after the meeting, we can send out that alert with the link to the comment site.
What's the timing to get those in?
So April 2nd.
By April 2nd. Because this is certainly something we could take to the governing council. We had them do a letter in support of the CDE technology project grant. They signed it as a governing council, listed everyone's name and their organization. So forward to that discussion. And we could, our next meeting with them is March 22nd, I think. So we can make that submission for sure.
We'll share that and I'll potentially work on just a higher level.
Yeah. Are there other thoughts, or what's the easiest way to communicate back with you, or how do we want to, for folks who want to participate, what do you think is the best communication tools to use for the letter the Health Foundation put together?
We could submit a draft letter to this whole group and those who want to sign
Okay,
respond to me. Does that work?
Perfect. Thanks.
I'll coordinate and connect with you.
And your action alert email will go out to us as well, or should we just go find it on the website?
You can find it at hungerfreecolorado.org/advocate, but also it'll
when we send the follow-up notes, we can certainly add that. I think that should be
Yeah, that'd be great.
Are there any questions about that from folks, or other information folks would like, or are we're
A different update.
Okay.
For the good of the group. And this is either a policy change or a policy clarification, but it becomes effective March 1st. It's actually really good news. I'm really excited about it. A little bit of background for elderly clients, SNAP clients who are 60 or older, people that have disabilities. They're able to deduct their medical expenses from their income. That can really raise their monthly benefit amount considerably. The magic number is $35 per month. Once you hit that threshold in medical expenses, then you qualify for what's called the standard medical expense deduction, and that will really boost your monthly benefits. The change that's going to occur on March 1st is the way that medical mileage is calculated. So when someone travels to a pharmacist or to their medical provider and they drive themselves, their mileage can count as medical expense. And the reimbursement rate is going to change effective March 1st. So it's going to go from 17 cents to 56 cents.
That is
56 cents.
That is really
So
incredible.
really big.
Yeah.
So it's the difference between having to travel about 200 miles a month versus I think 60 miles a month.
Right, and sometimes it's hard to hit 35, so.
Mhm. Yeah, especially if you're on Medicaid
Yep.
and you have co-pays, that might be a couple of dollars. You'll be at $20 a month, but you're short of that $35 threshold. So this will help a lot of people hit $35. And so you just have to calculate how often do you see that provider and what distance is there from your address to the provider's address, multiply it by 2 because you have to go to and from. You just put that in a statement, and it's very rarely, in my experience, screened for from counties.
Yeah, I was gonna ask, how are we gonna train folks on both the standard medical, which is being underutilized, and this new change? Because that needs to go to counties and it needs to go to community-based organizations to be able to advocate for that.
Right, because theoretically, all of this should be screened for in a standard interview. For
Right.
eligibility.
Well, that's a conversation, I mean, we could use help from our state partners, getting the words out to counties.
I believe there's a new SNAP trainer starting.
And we might talk offline about putting together a statement about this policy change and working together to disseminate that information.
Yeah,
But I just wanted to
yeah,
mention
our
that
senior
today.
partners might be able to help as well.
Thank you.
Yeah, that's awesome.
Got about 2 or 3 minutes left. Any other updates for the good group today?
Well, I would just be curious on the people that presented today, like if you had a wish list from this work group, what would be sort of the top wishes to help support your initiatives?
Somebody in person in high Medicaid offices or hospitals to help people enroll and do the interview there. A SNAP app like the WIC app that would take steps out of any process. Yeah.
Yeah, I think just having the time and the space to be able to get input and ideas. I mean, I think even with the task force, and we're not meeting anymore, but having the perspective of WIC and all of the other experiences at the table isn't always something we have the luxury of. So if we do have some time to just kind of get feedback on certain ideas we have, or other opportunities, I think that would be great.
Access to CMS.
Yeah, that's,
Hopefully for everyone. I think it'd be awesome to explore having somebody who's cross-trained in both WIC and SNAP who could potentially enroll that person. And then I think increasing communication on their own eligibility and just for WIC, hypothetically speaking, people would think that I don't want to take that away from somebody else, not knowing that we actually want more.
Right.
The more people that enroll, the more funding we receive. So, and that you can be in SNAP and WIC, and so just getting that message out.
That actually is an important message in the communities that I work in, because people who are on the edge frequently will say there's somebody who needs it more than I do, and they don't. So that's a good message to use
But
in
since some
many
of the
of the
evidence-based
communities.
marketing,
Mhm.
but to Kevin, we can make available around that it doesn't take away, that it's unlimited.
Right.
It's like Medicaid, if you're eligible, you get it.
Right, so I'm saying I don't think you need to target that message to communities that I work with. You need to amplify it so that all communities know it. And we can work with our own communities to make sure that they,
And to
Yeah.
tag on to the messaging too is all correspondence by Medicaid, WIC, and SNAP should be talking about the other programs and how much there should be mutual language and I agree with you, outreach. People should be trained in being able to do outreach on all of them.
Mhm.
I will say today I did have a meeting with the Building Better Health Planning Committee. And one of their goals this year is to work with brokers and our sisters on getting them to buy into helping their members with food, with SNAP and with WIC. And so we were discussing at the table, what does that look like? Because obviously they get afraid, like we don't want to help them apply for these programs, even though they're eligible for these programs. So is it something simple like something that they hand out to that member, to that customer that they help apply for Medicaid, even if it's just something that says you could potentially be eligible for WIC and these are the requirements and this is how you apply. Same thing with SNAP, because right now they're not seeing anything.
Right.
And so that's something that we want to work with Building Better Health. We're not going to have a conference this year. That stays in here for the funding, but we are looking at what we are going to do, whether it be regional training, but we are going to incorporate WIC and SNAP into this year's.
Yeah, I think whenever you can hand out information that is engaging, maybe not even getting into the weeds, because we know they're likely eligible if they're on Medicaid, the benefit of the program. And it may not, again, we may have drop-offs, but the more we reinforce in whatever space and place and community that they're in an engaging manner, the more likely they are to ask the question with someone who can help them. So I think like the engagement piece is really critical. And they have that, and your healthy communities staff in each community have so much ability to influence people's knowledge of these programs and engage them in a manner that's very different than they've probably been engaged in the past. But you have to have the materials, right? Yeah.
So we're just a little bit after 3. So thank you all for your attention today. It's a lot of information, it's a lot to take in. And we look forward to seeing you in a month if we don't.